My name's Nicole Denczek, one of the physical therapists with Pure Home Healthcare, and I'm going to be talking to you today about an exciting treatment approach to Parkinson's disease called Lsvt Big. Lsvt stands for Lee Silverman's Voice Training, and Big refers to the PT or OT aspect of the program. As a therapist allowed to perform an Lsvt Big program, I had to receive specialized training and a certification in the program. This certification has to be recertified every 2 years. There are only 26,000 therapists in the world who are certified to perform this program that helps to improve the lives of those with Parkinson's disease. To understand the purpose of the Lsvt program, I want to give you some background on Parkinson's disease. Parkinson's affects over 1 million people in the United States, and 60,000 people a year are diagnosed with Parkinson's. Men are 1.5 times more likely to be diagnosed with Parkinson's than women. Parkinson's disease is a disorder of the central nervous system that affects movement, which often shows up as tremors. This occurs due to nerve cell damage in the brain, which causes dopamine levels to drop, leading to the symptoms. The most common symptoms with Parkinson's include tremoring in one hand, slow movements, stiffness, loss of balance, and loss of smell. There are no specific medical tests that are used to diagnose Parkinson's. A neurologist will make the diagnosis of Parkinson's disease based on your medical history, a review of your signs and symptoms, and a neurological and physiological exam. Unfortunately, there is no cure for Parkinson's. Medication is used to treat the brain by increasing its level of dopamine, which helps to decrease the symptoms. Therapy also plays a big role in treating the symptoms of Parkinson's disease and teaching a person how to manage symptoms and improve their movement patterns. The Lsvt Big Program is an intensive amplitude-based exercise program for the limb motor system that re-educates the sensorimotor system. What that means in everyday terms is that as Parkinson's progresses, movements get smaller, and this program helps to retrain the brain to make normal-sized movements. For example, with walking, a patient with Parkinson's disease will often shuffle their feet, and on occasion they will freeze. This freezing is actually occurring because the movements have become so small that they can't move their feet any longer. The focus of Lsvt Big is to teach the patient how to take normal-sized steps through exercise and repetition, and repetition, and repetition. The program focuses on advancing the idea of treating amplitude in neurological disorders as a single focus. Lsvt Big has a standardized exercise protocol, a prescribed dosage with a method of delivery based on the Parkinson patient's functional level. The program consists of 16 one-hour individualized sessions, 4 days a week for 4 consecutive weeks. It requires daily homework practice sessions of 30 minutes for the treatment to be successful and a lifelong habit of practice to maintain the gains. A typical treatment session includes performing 7 maximal daily exercises, 8 to 10 reps in either the lying down, seated, or standing position based on the patient's functional level. The exercise that everyone will perform is called the floor to ceiling reach, and it looks like this. Big reach forward, reach to the ground, up to the ceiling, arms back, and hold to get your trunk to stretch out and get you moving better. Another exercise that is performed is the forward reach, and it looks like this. Ta-da! Big step forward and back. There is also a functional component task, which includes 5 functional tasks performed 5 repetitions. These tasks are developed between the therapist and the patient for things that have meaning to them. Some examples are practicing sit to stand, pulling keys out of a pocket, rolling in bed, opening a refrigerator door, brushing hair, or signing name. Walking big and hierarchy tasks complete the program. Hierarchy tasks are patient-identified tasks that build in complexity over the 4-week course. They are designed to bring amplitude rescaling into everyday living. Examples include going to the grocery store, practicing getting in and out of the car, laundry, gardening, anything that has meaning to the patient. The key to retraining the brain for large amplitude movement is repetition, repetition, repetition. This treatment protocol is a research-based program that has been around for over 25 years and has proven great results with proper follow-through of the program. One of my most memorable patients that I completed the program with was a 63-year-old gentleman who, when we started the program, could not stand up on his own, and it took him over 2 minutes to walk from his chair in the living room to the kitchen table, which was only about 30 feet away. We started the daily maximal exercises in the seated position and were able to progress over time to where he performed the exercises while standing up. The patient and wife were very dedicated and worked together every day on his exercises. By the end of the program, the patient was able to achieve his goals of being able to walk out of the home and over to his son's house using his wheeled walker, approximately a quarter mile away. His other goal was to be able to get down on the ground and change the oil in his tractor and then get up all without the assistance of his wife. And he was able to do that as well. Also, a great win was that the patient was able to get up from his chair in the living room and walk down and sit at the dinner table in under 30 seconds by the end. This was truly a great success story that had a major impact for both the patient and his wife. As part of the LSVT program, tune-up therapy interventions can also occur after you have completed the 4-week program. This is to ensure that you have follow-through with the program and you're continuing to make gains. If this program sounds like something you or your loved one would be interested in, please ask your neurologist for an LSVT referral to Pure Home Healthcare.